I'll be discussing modern advancements in total hip replacement with a focus primarily on rapid recovery. So to accomplish rapid recovery total hip replacement, it's really a multifaceted approach. It's important to kind of consider the full episode of care for the patient. And really this begins before surgery. And we'll go into each one of these topics a little bit more in detail through the talk, but changes have been made over the last several years in terms of optimizing the patient for surgery, the way that we perform the surgery, and then the way that the patient recovers after the operation as well. So, and what these rapid recovery improvements have allowed us to do is to essentially transition to allowing more patients to do same-day surgery where they come in early in the morning, they have their operation, and they're able to go home the same day of the surgery. I think a large part of this is the patient preparation. So a big part of patients having concerns about going home the same day or having apprehension about recovering quickly is just the unknowns. So a large part of this is counseling the patient in terms of what to expect after the operation, addressing their specific concerns about things that may be difficult after the surgery, going through really all of the unanticipated parts of the recovery, such as like the medications that they'll be using, the limitations that they may have when they get home. And patients typically get a preoperative manual as well so that they get everything that we discuss in written form. And then oftentimes we're able to actually have a physical therapist come to their house to address any specific concerns getting around the house or, review using the cane or the walker, practice some of the post-operative physical therapy exercises that they'll be doing, with the goal of all these steps to really reassure the patient that after the operation, they're going to be just fine and that they're going to have a good recovery. Intraoperatively, we've certainly made some changes over the last really probably 10 to 15 years. A big part of this with hip replacement is the way that we're doing hip replacement surgery, just the specific approach. For myself and many surgeons in the United States, the anterior approach in particular has certainly become more and more popular and more common. The nice thing about this approach is that it's really the only intermuscular approach, really the only approach that doesn't cut through muscle or tendon. And a poll last year at our American Association of Hip and Knee Surgeons conference showed that over 50% of total hip replacement surgeons are now using the anterior approach for at least some of their surgeries. So this is not really something on the fringe anymore or something that's rare. It's really become essentially mainstream. A nice thing about the anterior approach, and we'll review this a little bit more in detail, is that because we're not cutting any muscle or tendons, there's typically no restrictions after the operation. And because of this, numerous studies have shown that the recoveries are a bit faster, patients often require less pain medications after the surgery, and certainly this can be of benefit to the patient. So what are the specific potential benefits of the anterior hip replacement? We're able to use intraoperative fluoroscopy, which a lot of the other approaches don't typically use. Now, as technologies have become more common as well, such as robotics and computer navigation, they've helped compensate for potential component positioning issues in the other approaches, but the anterior approach using the fluoroscopy does help us place these components very accurately. Because we're not cutting any muscle or tendon, patients typically do not have any restrictions after surgery, and I think that this makes the recovery certainly a bit easier. And we'll go through a study or two, but there have been numerous studies now showing that the recoveries can be a bit faster. There can be less pain after surgery, earlier return to gait mechanics, and especially compared to like the posterior approach, for example, a lower dislocation rate with the anterior approach. So this was an interesting study performed at the Mayo Clinic. It was a randomized control trial, which was kind of our highest level of evidence in medicine. And it compared the anterior approach to a mini posterior lateral approach. And it essentially randomized patients to either the posterior approach or the anterior approach, regardless of who their initial consulting surgeon was. And what they found was that the anterior approach certainly had some benefits. So there was an earlier functional recovery with the anterior approach, so patients were able to discontinue their assistive devices and opioids a bit faster. They were able to ascend stairs and walk 6 blocks a little bit faster. They did have lower in-hospital pain scores, opioid use, and actually their patient-reported outcome measures were a bit better at 2 months. But this did equilibrate at about a year, so the potential benefits of this type of procedure might kind of level out as time goes on, which is likely. But importantly, there were no increased risk of complications or differences in the way that the components were placed. Now, we often say in orthopedics that there's no free lunch, and certainly that's the case with the anterior approach. Some of the potential downsides is that the lateral femorocutaneous nerve, which is a nerve that travels very close to the incision, can be affected during the operation, and this can cause some thigh numbness, especially over the distal and lateral aspect of the thigh. Now, importantly, in patients that do experience this type of numbness, most patients it resolves, so it's not a permanent issue. The most challenging part of an anterior approach hip replacement is placing the femoral component, and there have been some studies showing that there are slightly increased risks when doing that part of the operation. And then if a patient does require a revision surgery, which is a very low risk after the operation, typically surgeons are not using the anterior approach to perform a revision surgery. And not everybody is a candidate. These days, almost all patients are candidates for anterior approach, but in my hands, some patients that may not be a candidate, of course, if they're having the revision surgery, as we discussed. If they have a severe deformity of their hip that may require special implants or may require kind of an extensive exposure. And if they've had prior surgery with existing hardware that needs to be removed, oftentimes we need to see a bit more of the hip, and we need to have an approach that allows us to make a bigger incision. Another very important part of rapid recovery are modern day anesthetic techniques. A big part of this is what's called multimodal analgesia. So as opposed to 10 or 15 years ago, when we used to use narcotics quite heavily, these days we're using typically numerous medications at smaller doses to really help patients' pain levels stay low. And we found that these medications work synergistically together. So if you combine a number of medications at smaller doses, you're able to avoid the high doses of narcotics, which certainly slow down the recovery and come with a significant amount of side effect. And often these medications are started preoperatively so that you kind of get a head start on patients' pain levels and you're able to limit stiffness and pain after the operation. Anesthesiologists are often using short-acting spinal anesthetics, which allow us to really get the patient up quickly, as opposed to longer medications, which could take 4, even 6 hours to start getting patients up and doing their physical therapy. And oftentimes surgeons are using what's called an intraoperative periarticular injection, where we're using a long-acting anesthetic and we're basically dispersing that around the joint, and that gives us some added benefit for pain control after the operation. Wound closure, we're often using glue and an occlusive waterproof dressing that allows us to just have patients shower quite quickly. These are things that we do to really limit the burden on the patient after the operation and give them kind of as little worry as they can have after the procedure. So many patients ask, and even providers ask, well, why would you consider doing same-day outpatient surgery? Why would you want to rush this process? Are you putting the patient in harm's way by sending them home the same day of the operation? And I think we'll look at a few studies, but there are certainly a lot of benefits to the patient, and I think our current studies are showing that it's certainly not more risky than having them stay in the hospital. But some of the potential benefits to the patient are they get to sleep in their own home, they get to have loved ones take care of them versus having people they've only just met. They don't need to ask for their medications. They don't need blood draws. They get to move around their own home. And some studies have shown a reduction in infection risk. And certainly in our COVID era, some patients prefer not to have hospital exposure if possible. This was a poll from our recent conference from the American Association of Hip and Knee Surgeons. And on the y-axis, we see the percent of surgeons doing outpatient total hip replacement. And you can see in 2018, about just under 50% were doing this. And in 2022, this has increased to about 90%. So again, this is really becoming the norm, and most surgeons are doing outpatient surgery. Certainly not all patients are candidates for outpatient total hip replacement, but most are at this point. I think a very big part of this is patient interest. Patients have to want to return home. They have to be motivated to do that. They shouldn't have a significant health issue, so if they have organ failure or they require supplemental oxygen, probably not the best choice for them to go home the same day. It's good to have a caregiver at home, especially the first couple of days, just to make sure if there's any issues or unforeseen problems, there's somebody to help take care of them. And as mentioned, this is becoming a lot more common as you poll orthopedists, and soon, eventually in the future, it'll really be close to 100% of patients going home the same day. There have been a number of studies now looking at the potential risks or drawbacks to doing outpatient surgery, and really all of them have shown quite consistently that there's no significant increase in adverse events after sending patients home the same day. And patient satisfaction studies also reaffirm this. So if you poll patients who have had surgery at a hospital versus going home the same day, Almost all of them show that patients prefer going home the same day of the surgery, and also that the patient-reported outcomes are at least equivalent, but sometimes better. The last topic I just wanted to address, because it's becoming a lot more common for patients to ask this and for providers to ask it as well, is the benefit of robotic and computer-assisted surgery. So I think one thing that's become quite evident is that it does improve our implant positioning and accuracy. But the question is, because it adds time to the procedure and certainly cost, is it benefiting the patient? Is it improving patient-reported outcomes? So this was a recent study where a large group of authors looked at robotic versus conventional hip replacement. And what that they found was that the statistical difference was not significant for patient-reported outcomes. It did seem to improve implant placement accuracy, but they recommended further studies to really understand if it was truly benefiting the patient. This was also a study looking at patient-reported outcome measures. And again, they didn't find any significant benefits for patient-reported outcome measures. And so again, they're recommending further evaluation and better studies to evaluate this. Importantly though, patients seem to think that robotic surgery is better. So this was a study polling patients after surgery. And interestingly enough, about 70% of patients believed that robotic surgery was better. It resulted in fewer complications and less pain, despite our current evidence. And actually about half of the patients would prefer a low volume surgeon using robotic surgery versus a high volume surgeon using just conventional methods. So the take home points, just to summarize, overall total hip is an extremely successful operation. It's important to talk to your surgeon about what approach is probably best for you. Recent advancements have led to rapid rehabilitation with low risk of complications. And outpatient total joint replacement is a safe alternative for motivated patients with equal or lower risk and improved patient satisfaction compared to a hospital setting. So thank you for your time.